Okay, hi. Today I'm going to talk about shin splints. So a shin splint there are two different versions. There's one that's called a medial shin splint, which usually happens, and you can see this is my big toe, happens on the inside edge of your shin. Okay. Then there's an anterior shin splint, which happens right here along the tibia bone, and this anterior muscle that I'm kind of pulling away from the bone here. This is called your anterior tibialis. Okay. And here's your tibia bone. Okay, so my shin splint experience has been all anterior, where I get very, very tight in the anterior tibialis. And what happens with the shin splint is that the area between the anterior tib and the tib gets inflamed and actually starts pulling the muscle away from the bone, and you get this pain right through here. Now, the same thing happens with the medial, except that is generally from a tight calf muscle pulling and the inflammation happening right around the sheath that covers the bone here. Okay, so a couple of things with shin splints that's very important to remember. No matter what exercises you're doing for your legs, whether it's running or you're doing leg presses, whatever that is, it's always really important to remember to stretch out your calf. Okay, so the best stretch for your calf is obviously pressing back and down into your heel. You can do this, making sure that you're releasing this muscle. Now, the other thing you can do is bend the knee. Now remember, there's two muscles in the calf. You have this nice long muscle, and you have your short muscle on the inside here, okay? I'm not gonna get technical with the names, but just know that you wanna stretch both of those muscles. So doing this, 15 to 30 seconds, doing this, 15 to 30 seconds, trying to think about releasing those muscles, okay? That's super important. Now you can also get a tennis ball or a foam roller and sort of roll out and massage those muscles. Now that's important because you want to get that soft and released so that you're not pulling on your bone here. The other thing that you can do for a specific shin splint, now I have a towel here. I'm gonna show you a little trick I learned in physical therapy, is you roll up the towel. Roll it up so it's a nice roll. And then what you'll do is put your shin right on it and just sit. Now it serves the same purpose as a foam roller, but it's not as thick, not as hard. This has more give to it, and you can actually press right into that anterior tibialis here and get the same effect that you would get from foam rolling. But you want to exhale, think about breathing into it, letting it release. So important, because these muscles get really tight. Can happen because of the footwear that you're wearing. If you're running and putting a lot of pressure into your heel because you're flexing that muscle and it's contracting up. A lot of the time when you run heel toe, that's going to contract that anterior tib too much, and you're going to really need to think about releasing it. You can also learn different methods of taping to keep the muscle kind of attached to the shin, which is what I've done in the past. When I had my chronic shin splints, my physical therapist would tape like this with that running tape to bring your anterior tib to your tib to help alleviate some of that inflammation. So there's another option, or a compression sock, which serves the same purpose. So those are a couple of little tricks, but this trick with the towel, I'm telling you, anytime my shins hurt, which they do a lot, because I get that chronic tightness, is just this, and kind of rocking on it and helping to massage it and release it, breathing into it, of course. And you can do this for both, like that. And it feels pretty good, and you can just kind of press into it a little bit here. Okay, so there's a little trick with shin splints. Now, if you want to strengthen that area, there's a whole series of exercises that you can do with your TheraBand. If you have it, you want to strengthen up by, flexing and pointing, holding a band. You want to do circles to strengthen up those muscles in that area, loosen up the ankle. Another trick is to walk around on your heels and then alternate with walking on the toes. Heel, toe, heel, toe. That's going to strengthen up the muscles of the tib and the muscles of your calf. So you can just walk around doing that, alternate between walking on your heels and walking on your toes, and then sort of exaggerating your walking just to really work all those muscles and warm them up before you go out for a run or take a nice long walk or doing really any sort of cardio. So I hope the towel trick helps.